cranial nerve number 9. Okay, somebody give me a function for cranial nerve number 9. Anybody? Anybody remember? General sensation? Is that what you said?
Yeah.
General sensation for in the posterior 1/3 of the posterior 1/3 of the tongue. Which nucleus is it going to use for if it's general sensory information? Yeah, spinal nucleus or main sensory and spinal nucleus are trigeminal. So let's go ahead and draw that one in here. So here's your main sensory and spinal nucleus of trigeminal. Right? Okay, so information. So this is going to be general sensation. So we're going to say general sensation for cranial nerve number 9. What specifically sensory information does it carry? General sensation, general sensory. Give me something. So here's one posterior 1/3 of the tongue. Yeah, good. The posterior 1/3 of the tongue, general sensation from the middle ear. Nasal-oral pharynx. So this is all cranial nerve number 9, nasal-oral pharynx. Anything else for general sensory? Nope, nothing else. So what happens is information here, that's cranial nerve number 9. Information is received and carried through cranial nerve number 9, enters in these axons, synapse here. Let's say the spinal nucleus of trigeminal, because it's carrying afferently general sensory information through cranial nerve number 9. Give me another function for cranial nerve number 9. Anybody? Innervates the carotid. Correct. Innervates the carotid. I didn't draw my good line. The carotid body and the parotid. So what should we do first? Would we like to do the parotid or the carotid body?
Carotid body.
Parotid or carotid? P? K. Carotid. Okay. K. Okay. Which nucleus does it use for carotid body?
The solitary.
Solitary, good. Here's your solitary nucleus. Just draw that in here. Good. Now, solitary nucleus, so this is going to be just general sensory information coming from the carotid body. Okay, it's going to travel through cranial nerve number 9, come in and synapse on the solitary nucleus. Okay, anything else that cranial nerve number 9 might use the solitary nucleus for? Great, taste. And it's also going to be taste for the posterior 1/3 of the tongue. Okay, so that information is going to travel here through cranial nerve number 9, come on down, synapse with the solitary nucleus. Awesome. What other functions does cranial nerve number 9 have? Parotid gland, right. And which nucleus does it use for parotid gland innervation? There it is, the inferior salivatory nucleus. Awesome. Hopefully now you can see why I have you do the cranial nerve review function review before we do this. Inferior salivatory nucleus. Okay, so inferior salivatory nucleus, this neuronal cell body here, sends out an axon that travels through cranial nerve number 9 and is responsible for innervation of the parotid gland. one more functional category for cranial nerve number 9 that we have not hit. It's just a little one. Yeah, stylopharyngeal muscle. And which nucleus does it use for that function? Doesn't know who it belongs with. This is the nucleus ambiguus. I'll just put it here. That's your nucleus ambiguus. Okay, nucleus ambiguous, so lower motor neuron cell body here residing in the nucleus ambiguous sends out axons that travel through cranial nerve number 9 and innervate that stylopharyngeal muscle. Okay. That's cranial nerve number 9. How about cranial nerve number 10? Cranial nerve number 10, and again,
Busy guy.
so is 9. Yeah, they're both busy, but 9's mostly sensory, 10's mostly motor. Okay, again, I didn't leave myself room, so I'm going to put 10 here. Realize it would be up here, but this is as close as I can get right now. Okay, there's cranial nerve number 10. Okay. Anybody with a function for cranial nerve number 10? There's a few. Muscles of the soft palate. Okay, that's going to be a voluntary motor function. So, to innervate muscles of the soft palate, which nucleus is it going to use? Ambiguous. Great. So, lower motor neuron cell body here, sitting in nucleus ambiguous, comes out. And this is going to be for voluntary motor activity. This is going to be muscles of soft palate. Right, I hear it over there, larynx and pharynx. Okay. That's going to be the voluntary motor activity for cranial nerve number 10. Give me another function for cranial nerve number 10.
Parasympathetic function of the GI, lungs, and heart.
Perfect. Parasympathetic function is going to be through the dorsal motor nucleus. So we'll put the dorsal motor nucleus here. Okay. Dorsal motor nucleus is parasympathetic innervation, so neuronal cell body is going to send out axons that travel through as cranial nerve number 10, and that's going to be parasympathetic for heart, lungs, and GI. Okay, and that uses, cranial nerve number 10 uses the dorsal motor nucleus to accomplish that function. Give me another function for cranial nerve number 10.
Visceral sensory.
Visceral sensation. Awesome. So let's talk about visceral sensation in the area of the heart, lungs, and GI tract. Okay, information, afferent information from the visceral sensation from the heart, lungs, and GI is going to travel up through as cranial nerve number 9, come in and synapse with neuronal cell body here in the solitary nucleus. Okay, any other functions for cranial nerve number 10? How about taste? Does it have any taste associated with it? Does it pick up taste? Yeah, base of the tongue and epiglottis. So we'll keep that in purple. So here's going to be taste from the base of the tongue and epiglottis. Okay, so that taste information is going to travel up here through cranial nerve number 9 and synapse on a neuronal cell body in the solitary nucleus because it has to do with taste. There is one more function for cranial nerve number 10 that we haven't hit? Just one. General sensory. There's a general sensory. General sensory of what? Larynx and pharynx. Great. Since it's general sensory information, what nucleus is it going to use? Yep, the main sensory and spinal nucleus of trigeminal. So this is going to be general sensory for larynx and pharynx. Here, write it down here. General sensory for larynx and pharynx. Okay, general sensory for larynx and pharynx. That information afferently is going to travel through cranial nerve number 10 and go all the way up in synapse with, let's say, the spinal nucleus of trigeminal. And that is all the functions for cranial nerve number 10. Questions? Are you okay, Morgan? Do you have a question? You can ask me.
I just kind of written down those larynx and epiglottis for the general sensation.
Oh, you're right. It's larynx and epiglottis. Thank you for that correction. It's larynx and epiglottis, not pharynx. Epiglottis. Larynx and epiglottis, not larynx and pharynx. General sensation for the pharynx is going to be cranial nerve number 9. Thank you. Any other questions? Moving on, there's only one more cranial nerve that we have to deal with. It's a simple one, and it's going to be cranial nerve number 12. I'm going to draw it on this side. Cranial nerve number 12. Cranial nerve number 12 just has one nucleus to deal with. It's this big old long one here in the medulla. It's your hypoglossal nucleus. Okay, so lower motor neurons, cell body here, and the hypoglossal nucleus is going to travel out through cranial nerve number 12 and innervate tongue muscles. And that's it. We're going to skip over cranial nerve number 11 because the lower motor neuron cell bodies are going to be in the ventral brain cord of C1 through C5, and they're not part of the brainstem proper. Questions? Is it making more sense this time around? Yeah? Perfect. So, moving on. Let's look at the sensory cranial nerve pathway. Okay. So the cranial nerve that has the majority of sensory information coming in is going to be your trigeminal nerve, great big old nerve. It has kind of like, if you remember, I hope you remember, in the spinal cord there's those dorsal root ganglia. You know, that's where the first order neuron cell bodies are housed. Well, for the cranial nerves, they have their own ganglia. Okay, the big one's going to be your trigeminal ganglia, and it sits right about here, about the temple of your head, bilaterally. Okay, that's your trigeminal ganglion. And I'm just going to represent it here, kind of like sort of looks like the dorsal root ganglia a little bit. This is going to be your trigeminal ganglion. Okay? It's your trigeminal ganglion, and it's very similar to the dorsal root ganglia because it houses the first order neural cell bodies of your sensory neurons. So first order neuron for trigeminal, here's the neuronal cell body with little stalk, and then dendrites here for V1, V2, and V3. Okay, and since I said it's the trigeminal nerve, There's my trigeminal nerve on the outside, piece that you see that travels through. And we're talking about general sensory information. And I'm just going to put my midline in. General sensory information, we've talked about multiple times, goes through the main sensory and spinal nucleus of trigeminal. Okay, I think we're pretty much set up. So, information afferently coming into the system through the trigeminal nerve is going to be perceived or picked up by V1, V2, and V3, which essentially is the sensory component, the general sensory component for the trigeminal nerve. Travels in here through the nerve in synapses. This is your first order neuron. It's going to synapse in the main sensory and spinal nucleus of trigeminal with the second order neuron, neuronal cell body. Okay, no different than what we've seen in the past. And think about STT. When I think about the trigeminal, the general sensory system, I think about STT tract. So this is the second order neuronal cell body. Okay, that second order neuron sends out axons, and just like all the other second order neurons, those second order neuronal axons decussate to the opposite side. Okay. Luckily, that decussation does not have another name that you have to remember, so we're good there. But it travels up to the level of the thalamus in synapses with a third order neuron here in the thalamus. So as it travels up through the rest of the brainstem, it is called the trigeminal thalamic tract. So this is the trigeminal thalamic tract. The trigeminal thalamic tract is nothing more than neuronal axons from the second order neuron that's located in the main sensory or spinal nucleus of trigeminal that have decussated and are now traveling up the brainstem to the level of the thalamus. Okay, once they get to the thalamus, they synapse with the third order neuron, and you should know that. What's the name of the thalamic area where the third order neurons for STT and DCML synapse? VPL. Okay, well this guy is not VPL. It's located in a VPM. So instead of ventral posterior lateral, it's going to be ventral posterior medial. VPM. So just located in the VPM, or ventral posterior medial area of the thalamus, and these are nothing more than third order axons, neurons. That's your third order neuron, and that third order neuron is just going to send out an axon that's going to synapse in the area of the somatosensory cortex that's specific for the face, right? Because you're picking up information from the neck up. So, somatosensory cortex, let's say face area. Okay. And that's it, in a nutshell. Very similar to SCT. Comes in, synapses, decussates, goes up, VPL, goes to VPM, and then goes specifically to the area of the face, because that's where it's receiving sensory information from. Questions? questions? Good. All right, let's move on from the sensory to the motor. Okay, and the motor pathway. This motor pathway is going to apply for all the cranial nerve motor nuclei except for cranial nerve number 7, which is just a little bit different. Okay, we'll cover cranial nerve number 7. I think we'll do that. I don't know if I'm going to have enough time for it or not. We'll see. I have 6 minutes. So, standard presentation, you have your thalmi here, you have your lentiform nucleus, which is globus pallidus internus, globus pallidus externus, and putamen, all part of the basal ganglia, cortical region, midbrain, pons. Okay, thinking about motor information here, again, I'll pick on the trigeminal nerve, and the trigeminal nerve, I'm going to draw it here bilaterally. It's going to come out on the sides. And really, this could be any of the motor nerves. But I'm just going to say it's cranial nerve 5. Okay, so cranial nerve 5 bilaterally. Okay, cranial nerve 5. What nucleus is it used for voluntary motor function?
Muscles of mastication.
What nucleus is it used?
Oh, sorry.
Motor nucleus of trigeminal. Yeah, just that simple. So here's the motor nucleus of trigeminal. Draw that in, because that's the nucleus that's going to have the lower motor neurons in it. So this is motor. Okay, and I've just drawn that bilaterally, because that's what's going to use to be responsible for innervating muscles of mastication. So the upper motor neuron is up here in the primary motor cortex, which we've seen many a time. It's going to be here bilaterally. We'll just start with one side. That upper motor neuron is going to send out axons that travel here through the internal capsule, and it's going to synapse with its lower motor neuron. It's going to synapse with the lower motor neuron ipsilaterally. Okay, and it's also going to synapse with a lower motor neuron contralaterally. Okay, so upper motor neuron here in the primary motor cortex on the left side, for all cranial nerves except cranial nerve 7, synapses with both motor nuclei of trigeminal bilaterally. Same thing happens on the right side. Sends out axons, travel here through the internal capsule all the way down and synapse with lower motor neurons ipsilaterally, as well as lower motor neurons contralaterally. So those lower motor neurons then send out axons that travel through cranial nerve 5 and innervate muscles of mastication bilaterally. Okay, the significance of this is that if you have damage, if you have a stroke, or if somebody's had a stroke and this whole side is gone, only one side is gone, you still get motor innervation for muscles of mastication bilaterally, since one side innervates synapses with both motor nuclei, bilateral motor nuclei. Does everybody see that? I think that's where we're going to. So there's only one more thing. This track. Remember how upper motor neurons for voluntary motor for trunk and muscles of extremities is the corticospinal tract? Okay, this is going to have a special name, this tract. Okay, it's going to be one that we see later on. This is your corticobulbar, B-U-L-B-A-R tract. The corticobulbar tract is nothing more than carrying motor innervation from the it's part of the upper motor neuron system, traveling down to the lower motor neuron, which is the specific nucleus. Questions? think we're almost caught up, doing good. I think next class, okay, go ahead.